You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone podcast. Thank you so much for joining me. If you'd like to know more, you can hop on over to holisticdentistry.au. I run and own my own dental practice in Kenmore in Brisbane, and I have been working holistically since around 2000. And in that time, I've helped thousands of people just like you have healthy smiles and healthier lives. It's important to me that dentistry goes beyond just the checkup and clean, that we're working with you to help improve the standard of life, to help you stay healthy, fit and well. And that is why I became a holistic dentist and opened my own practice in Brisbane in 2005, where we provide many services, but with a holistic edge to help support you to reach your wellness goals. I like to think of myself as not your typical dentist. I'm a passionate opinion leader and I like to challenge convention, and I want to empower people to make better dental and health choices. We've been helping thousands of people to have natural healthy smiles. I am going to talk about amalgam and why you might want to consider having it removed and answer some of your questions around that. So one of the major services I offer as a holistic dentist is safe amalgam removal. So it doesn't come as a surprise if I said to you that I'm frequently asked questions like, what is amalgam removal? Why is it done? What's involved? Is getting my amalgams removed difficult? Is it expensive? And how long will it take? And what other things do you need to bear in mind? And I'm going to address and answer as many of those questions as I can. So firstly, let's start by looking at what amalgam is. Dental amalgam is a filling material called silver filling that's been used for dentists for over 150 years. If you have a peek inside your mouth and you see those silver metal fillings or metal fillings that look black, they're often placed in your back teeth. Well, those are amalgam. So why should that concern you, or why should people be looking at replacing them? Well, dental amalgam is a mixture of silver, copper, tin and other metals mixed with 50% or more mercury. Now, mercury is a toxic heavy metal and it's detrimental to health. Yet, as dentists, we're trained that it's okay to mix it up as a filling material and implant it in your teeth. Well, if this is the case, then surely it must be safe. Well, not exactly. Because what happens is studies have shown that the mercury from the filling actually vaporizes and leaches through the lifetime of you having that filling in your mouth. And that's like having a little tap that's drip feeding mercury into your body every time there's any warmth or friction or pressure put onto those fillings. So if you have a hot meal and a hot drink, you clench or grind your teeth, those fillings are releasing mercury vapor. That mercury vapor then enters into your bloodstream via your lungs, where it quickly passes into the cells of your brain and other organs. Now, once it's in your body, it's really quite hard for your body to get rid of it, and therein lies the problem. So mercury is one of the most toxic of the heavy metals, and having it in your body can lead to a whole host of complications and potential health issues. And that's why holistic dentistry advocates amalgam removal and not using amalgam as a filling material. So those amalgam fillings that are sitting there in your back teeth are acting as a reservoir for mercury. It's constantly drip feeding day after day more and more mercury into your body. Now, having amalgam fillings in your teeth makes it harder for your body to actually detox and remove mercury from its tissues and cells. So more and more accumulates over time. Now, if you're eating a poor diet and you don't have all the nutrients and minerals that you need, mercury is going to accumulate faster. Also, if you've got genetic predisposition to not being able to collate and detox, then you're going to be a susceptible individual. Now, I'm not going to just say, go rush out and get your nearest dentist to take out your fillings. Don't do that. Don't demand that that happens. Because what happens is when those fillings are drilled, significant volumes of mercury get released from your filling because of the massive amount of friction that the drilling actually creates. And friction and heat of any kind, from chewing, hot drinks and foods, as I've mentioned, even brushing your teeth, the dentist drill especially is going to cause mercury to vaporize from the amalgam. Now, the mercury vapor coming off your filling via the drill ends up being inhaled by you and also the dental team, so the dentist and their assistant, and it can be more harmful to you than if you'd had the filling just left alone. So the removal and the replacement of the amalgam needs to be done carefully and safely by a dentist who understands the implications of mercury and is trained in the safety protocols and technique to protect you from what that mercury can do. So the silver filling, I'm just going to repeat myself a little bit here, is not a true alloy. It's actually that mixture of metals and 50% mercury. And there are millions of these fillings being placed in people's teeth every day. People say to me, well, dentists don't use it anymore. Well, actually they do. I was also told that they took the mercury out of fillings 20 years ago. Not true. So if these are some of the dental myths that you believe, I urge you to have a look again. So mercury is as dangerous as lead and arsenic, and it vaporizes from your fillings. People with amalgam fillings will exceed occupational exposure limits that have been set in Europe and North American countries. So if you've got more than 4 tiny little amalgams, you're running a significant health risk from the mercury. And in children, it's only 2 amalgams. I cannot believe that dentists will still place amalgam in children's teeth. So you're going to be absorbing mercury from that as well as from your environment. And many countries such as Germany and Sweden and Denmark severely restrict their amalgams. Now in Europe, they are about to enforce a ban, and the same in New Zealand, a ban on the use of amalgam fillings in children, pregnant women and people with medical conditions because they are that concerned about the health risks from the mercury leakage. So what happens to that mercury vapor? Well, it leaks continuously from the entire life of the filling, from the moment it's placed to the moment it's gone. That filling will leak mercury for longer than you're alive. But when we drill it, or when you chew on it, you also get particles coming off that filling. You're sort of chewing them and you'll ingest them during the day. The mercury is going to pass through your cell membranes, across your blood-brain barrier, and it's going to damage your nerve tissue and also your pituitary gland, which is in charge of controlling all your hormones. So the vapor is the primary route at which you're going to get mercury from those fillings, and it's going to accumulate over time and cause a potential health threat. Now look, if we placed your filling and you got sick a week after and you all got the same symptoms, we'd know for definite, hey, that's coming from the mercury in your filling. It doesn't happen like that though, because it's a slow accumulation. It may not be till 10, 20, 30 years later that you develop health issues, which we then consider normal as part of aging and processes. So there have been radioactive studies that talk about mercury that's been mixed into the filling, and then tracking where that goes and seeing that the radioactive mercury ends up in the kidneys, the brain, the thyroid and the stomach. What does the mercury do? It attaches to your cells and it blocks the biochemical processes. So it interferes a little bit with uptake of nutrients and enzymes, the way messages are sent from one cell to another. And it competes with your minerals. So it's essentially depleting the body of them as well at the same time. You need minerals for your body to work, and without them, you're going to end up low in energy. So the mercury impacts the functionality of the body. It impairs your immune system, your nervous system, hormone production, kidney function, cardiovascular system, and on and on and on. So some of the symptoms of mercury have been very well documented. There's been toxic exposure, chronic long-term exposure. So the literature shows that mercury has been associated with a lot of problems from Alzheimer's disease, autoimmunity, infertility, food allergies, MS, thyroid problems, and on the list goes. It's even been suggested that amalgam is linked to fatigue, depression, poor memory, and psychological disorders, tremors, insomnia, emotional problems, irritability, headaches, weakness, blurred vision, and memory problems. Now, your nervous system is the most sensitive to mercury toxicity. And so it binds really tightly to that because it's high in fat and high in sulfur, and mercury forms these long compounds with that. Other studies have shown that it's also taken up in the nerve endings in your hands and feet. And so you can end up with like pins and needles and numbness and change sensations. So unless it's actively removed from the body with detox, it has a very long half-life. So it stays within your brain for about 15 to 30 years. So let me explain what that means. It takes 15 to 30 years for half of the mercury in your brain to be excreted, then another 15 to 30 years for half of that half, and so on. So that's a long time. So to eliminate mercury, our body has excretory pathways and detox. So the most common is out through your urine and your feces. And there are agents that can be used to help expedite that for detox and chelation. But the most important part for you to be able to get rid of mercury from your body is to remove the source of it. And that includes taking out those silver mercury fillings. Now, as I said before, please don't just rush out and ask any dentist to do this. You need to seek help from a dentist who is specially trained and knows how to properly remove them without giving you an unnecessarily high exposure to mercury. Once it's been removed, they should also be recommending supplementation with minerals and antioxidants, dietary modifications, either through their own training or through the support of a naturopath or an integrative GP. So really, essentially, if you've got amalgam fillings, then you need to be looking at, your health, what's going on in your body, and considering whether your mercuries could be the source of the issue. So by removing those fillings, it actually helps your body to detox processed stored mercury. And I'm going to talk about in future episodes how we do that, how we make it nice and safe for you, and what steps you can take for yourself. I trust you're finding this interesting and helpful and that it's useful. And I'm just going to kind of go over some stuff again, hit the point home, maybe add in a few little extras. So the amalgam fillings, I choose not to use it because they contain mercury. That mercury is 50% of the filling. The rest of the filling is silver, tin, copper, probably zinc, and millions of mercury fillings are placed each year just in the US alone. And here in Australia, a lot of dentists still use them for restoring the back teeth. Mercury is a highly toxic metal, heavy metal. It's considered as dangerous as lead and arsenic. Yet dentists are still trained. It's perfectly safe because once you mix it in with the other metals, somehow it changes in its nature. But that mercury from the filling evaporates, as I've said, as a vapor every time you chew, grind, swallow, brush your teeth, or the fillings get warm. You're going to be swallowing about 3,000 times a day, so that's going to release mercury vapor. You're having a cup of tea, cup of coffee, brushing your teeth, having a snack. We're clenching and grinding during our sleep. A lot of people clench and grind during the day, and so we're releasing mercury vapor on a regular basis. And studies have shown that after you've eaten or you've had a hot drink, those mercury vapor levels stay high for around 90 minutes for 2 hours before they start to drop back down. So essentially, you're getting constant exposure from those fillings. People with amalgam fillings exceed all the occupational exposure limits for mercury allowances set in all European and North American countries. People with 4 or more amalgams run a significant health risk from mercury, while in children, as few as 2 amalgams will contribute to health problems. How much mercury is released from your amalgam fillings? Well, it depends on the size of the filling, how much surface area there is, and the age of the filling. The older the filling is, the more mercury starts to get released. But a single amalgam filling of a surface area of around 2 millimeters by 2 millimeters releases about 15 micrograms of mercury a day through mechanical wear and evaporation. Your average individual has around 6 to 8 amalgams, and their absorption goes up to 120 micrograms a day. Well, what does that mean? Well, if you compare that to the daily absorption of all forms of mercury from the environment, from fish and seafood, that would be about 2.3 micrograms a day. So we are exposed environmentally to a lot less mercury than we are from amalgam fillings. Now, countries like Germany, Sweden, and Denmark don't allow the use of amalgam and haven't done for a long time. And I am pleased to say that it is starting to be phased out in other countries, except the guidelines are very loose. So here in Australia, they've just said that you shouldn't be using it in pregnant women or in children unless there's a very good clinical reason to do so. Well, what is a good clinical reason? Because it suits the dentist, or I don't know. It's so grey. It's such a grey area. The mercury from your filling will escape during the lifetime of the filling, mainly as the vapor, but also as metal ions and abraded particles, so bits of your filling break off and you swallow and you ingest them. Chewing, brushing, and hot fluids, hot meals, that stimulates the release of mercury. It becomes inhaled into your lungs, transferred into your blood. Now, because mercury is fat soluble, it passes through the cell membranes and across your blood-brain barrier, where it adheres to your nervous system tissue and your pituitary gland, which is the gland that controls the production and your balance of hormones. That vapor is the primary route of getting mercury from your amalgam into your body and into the other tissues, and it accumulates over time. So it builds up and it builds up and it builds up and it builds up until you hit a point where your body can no longer deal with it. And animal studies have shown that radioactive labeled mercury releases from amalgam fillings, and it appears very quickly in areas like the kidney, the brain, thyroid, and the wall of your intestines. But there are other things that happen with amalgams. It's a mixture of metals placed into saliva, which is a warm, salty solution. We're essentially creating a battery. So you get these electrical galvanic effects. So when you get dissimilar metals placed together, they make this battery effect and they conduct electricity because of the saliva. The electrical current causes metal ions to go into solution at a much higher rate, increasing exposure to mercury vapor and mercury ions. And if you've got gold or other metals placed next to or near amalgam fillings, that's going to produce a 10-fold increase in the release of mercury. Mercury attaches to the cells. It goes into their receptor sites, which is where you'd normally have your hormones and other minerals and enzymes going in. It blocks the biochemical processes of the body by interfering with the way the messages are sent from one cell to another. It stops the minerals and enzymes being able to do their job. But mercury also competes with essential minerals. But not only that, it depletes them from your body. So you become low in things like magnesium and zinc that you need to function. These actions impact the functionality of your body. It impairs your immune system, your nervous system, hormone production, kidney function, cardiovascular system, energy production, and so on. It is a very, very detrimental and significant toxin. We know in medicine and science that mercury is toxic. The symptoms and the clinical effects of mercury have been very clearly described. And in literature, it shows that amalgam fillings have been associated with a variety of problems because of their mercury content. So it can be linked to things like Alzheimer's disease, autoimmunity, kidney dysfunction, infertility, food allergies, multiple sclerosis, thyroid problems, impaired immune system. We could just go on, and it's related to things like fatigue, depression, poor memory, psychological disorders, neurological problems like tremors, insomnia, emotional irregularities, irritability, personality changes, headaches, weakness, blurred vision, slowed mental response, and memory problems. And to think that they're putting this in your teeth and telling you it's safe. But they're also, by doing that, exposing dentists who have no clue that they're getting exposed to a really nasty toxin during the lifetime of their career. And we wonder why wonder why dentists have high rates of depression, anxiety, suicide, and poor health issues. The nervous system is really sensitive to mercury toxicity more than any other organ in the body. Mercury in the central nervous system causes physiological, neurological, and immunological problems. Sorry, I just got my tongue all in a twist there. It causes immunological problems in humans. So I'm just having trouble with that word today. And it bonds very firmly to the structures in the central nervous system because it has an affinity for sulfur. So other studies have shown that mercury is taken up into the peripheral nerve endings. It's rapidly transported into the spinal cord and brain stem. Unless actively removed, mercury has a really long half-life, somewhere between 15 and 30 years in the brain. This means it takes 30 years for half the mercury to be released, and then another 30 years for another half, and so on. Mercury exposure has been associated with heart and cardiovascular conditions and so many other problems. Your body can, to some extent, naturally detox and eliminate some mercury. Some people's bodies are better adapted to that than others. Others have genetic conditions which mean a genetic predisposition, which means they actually can't detox mercury very well. Now, the main route in which your body gets rid of mercury is through the urine and the feces, and this helps get rid of metallic and mercury in humans. There are a number of agents that we can use to help facilitate the removal of mercury, and they have been demonstrated as very efficient in people with signs of mercury toxicity. But the most important part of systemic elimination of mercury is to actually remove the source of it. And for most people, this involves removing amalgam fillings. And to do this, I'm going to stress it again, you should seek a dentist who is specially trained in this area, because improperly removed amalgam will result in an unnecessarily high exposure to mercury. So please make sure you get yourself an holistic, smart certified dentist to take care of your amalgam removal. Once we've removed the amalgams, we're going to recommend detox, so supplementation with minerals and antioxidants and maybe some dietary modifications to assist your body to eliminate mercury. Now, I get asked this a lot. Is taking them out dangerous? Well, yes, if you don't have it done, follow safety protocols. With the safety protocols, we minimize the exposure to mercury during the process. But if I was to take a blood sample before the process, you would probably have little to no mercury in your blood because it doesn't get stored there. It likes to go into those areas of high fat and high sulfur, your brain, your kidneys, your thyroid, your intestinal linings, your cardiovascular system, as I've discussed. But once we remove the amalgam, what happens is that your systemic blood levels actually do increase a few days after that process. So the conclusion that you could logically make would be that that increase must be because you've been exposed to vapor during the process, even with their safety systems. But because we lessen that, and it has been scientifically tested and proven that it does work, that the actual exposure during the process with the SMART protocol is exceedingly low, why would there be an increase in mercury in the blood and the plasma about 48 hours after the mercury removal? Where does that mercury come from? Well, when the fillings are sitting there in your mouth year after year, a small amount of mercury vapor is given off constantly. Even the traditional or conventional or mainstream dental community accept that, but they covered it very quickly by going, oh, it's such a small amount, don't worry. They do acknowledge that some of the mercury is absorbed into the body, but they don't believe it's enough to be a significant health hazard. Significant health hazard in quotations. Mercury is given off, it goes into the brain and the kidneys, but that's going to vary for different people. So when we take out the fillings, there's this kind of pressure or distribution of mercury pushing the mercury out through the body. You remove the fillings and any mercury that's been held within the bodily tissues suddenly has less pressure, and therefore it comes out of stores and goes into the body and circulates around the bloodstream. That is why you get increased mercury in the blood for a period after amalgam removal. But it doesn't just stay there, it then goes and hides again. But while that mercury is circulating freely, it's going to show up as increased levels, but it means that we can actually get hold of it during this time, during a detox, and have it out through the body. The problem is that as you get that spike of mercury in the bloodstream, very rapidly in those first 48 hours and then declining over the next 3 to 6 months, you can sometimes get symptoms of mercury toxicity developing or worsening. But as I said, it's the window for us to help you excrete that free floating mercury from the body by using simple things like free radical scavengers, minerals, antioxidants like vitamin C and other chelating agencies. So it is entirely up to you after listening to this, whether you get your amalgams removed or not, how you go about it, how many you get done in one go. But if you do go ahead, please make sure you get a SMART certified dentist. Amalgams are the number one source of mercury exposure, and they should be removed safely by a holistic dentist who understands the risks, follows SMART protocols to ensure any mercury exposure to you, themselves, their dental team, and the environment is minimized. And yes, I am a SMART certified holistic dentist. I am a mercury safe dentist. I have removed up to almost 30,000 dental amalgams in the past 20 years. If you'd like to book your safe amalgam removal consultation, then please give my dental office in Brisbane a call on 07 37 20 1811. Thank you so much for joining me. I'm Dr. Rachel Hall. This is the Dental Zone podcast. I hope you found the information in this episode useful, enlightening, educational, supportive. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.